Since the day all 3 of my kids were born, they've been adjusted. And that probably makes sense since I'm a chiropractic physician. Why not, right? But I get that question all the time. Should kids be adjusted, and when and how? And it's a really interesting question because there isn't a one-size-fits-all for that question. But I will tell you it is important because they have a spine just like adults do, and their spinal health can play a huge role. Let's talk about it just from the standpoint of activities or even lack of activities in kids as we're moving into wintertime. So if your children have been involved in sports, or they're completely sedentary, there are different effects that can have on spinal health, right? So you take the child that maybe is in cheerleading and they're thrown up in the air regularly and they fall quite frequently, right? Simple. And maybe some of that stuff gets ignored, but the impact that can have on the spine can make a profound difference where now all of a sudden your child's in high school and she's complaining of low back pain. And yet she's way too young to be having low back pain, but yet the history of being a cheerleader absolutely played a role in that. Let's go to the other side. We now have the kids who love to sit in their books. They're constantly doing homework or reading, or they're in front of the video games on TV, and they're completely sedentary and they're not moving around, right? That also has an impact on our spinal health because with movement, we're mobilizing joints and we're moving fluid in and out to help keep those joints are really healthy so that we don't have aches and pains that way either. And although this sounds very generic and it's not very specific in terms of any sort of disease function, we want to keep kids moving appropriately so that if they're sedentary, their spinal health is also good. If the kids are reporting any sort of pain in their feet, in their calves, in their shins, knee pain, low back pain, headaches, shoulder hurts, wrist pain, thumb pain from too much texting, those are all signs that there is something definitely wrong and needs to be addressed. It is not a typical thing that we go through as children. So from a chiropractic standpoint, we love to work up the kids doing a complete physical examination, including some neurological examinations as well, to assess to see if there is any dysfunction as a result of either excessive activity, normal activity, or lack of activity to help keep them healthy. Come check out chiropractic. Even kids from infancy on should be adjusted.